Something that is getting more attention is an entity that's been termed interstitial lung abnormalities, or rather early interstitial lung abnormalities. And there was a paper that was published that looked at 4 large databases or cohorts of patients who enrolled in various clinical trials. There was a Framingham Heart study, and the AGES study, which was an Icelandic study, the COPG study, and the ECLIPSE study. A couple of thousand patients in each of these studies. And what was common to all of these studies was that patients had to have a screening baseline CAT scan at the start of enrollment. So what these authors did was they went back and they looked at the presence of interstitial lung abnormalities on the initial screening CTs, and they followed up on these patients with and without interstitial lung abnormalities to see what the outcomes were. As you can see in this slide over here, a very common feature to all of these studies was that those patients who had interstitial lung abnormalities had worse outcomes and a greater likelihood of mortality in the ensuing years. What was also interesting and quite common through all these 4 studies was the prevalence of early interstitial lung abnormalities, which was around 7% for all of these cohorts. The message from this is that the presence of early interstitial lung abnormalities has clinical meaning. And the reason why some of these patients likely had a higher mortality was that some of them evolved to develop various forms of interstitial lung disease, the most common, most likely being idiopathic pulmonary fibrosis. And that's why through the years we see these curves come apart.